Testing audio, 1 2 1 2, testing audio, seeing if the audio levels are nice. We're checking the audio, seeing if the audio is nice, seeing if it's coming through, checking the audio testing, 1 2 1 2, audio testing, checking out the microphone, checking out the levels, making sure the audio is nice, seeing if it's coming through, checking the audio. Okay. Audio test 2, checking out the audio on the other microphone, audio test, checking out the other microphone, audio test, checking out. Okay.
Afternoon and welcome to today's briefing. It's a busy time of year and I want to make sure everyone has the information they need to have a safe and peaceful holiday season. Today I'll go over the most recent COVID data. We'll look at the trends we're seeing, including for flu and RSV, and the impact this is having on our healthcare system. I also want to share information about the new bivalent booster available for children 6 months and older, and other ways to minimize the transmission and impact of illness during the holidays. I'll take the next slide. As I do each week, I want to share the updated trend lines for COVID-19 to provide the overview of how things look in LA County right now. On this graph, you can see the trend lines dating back to April of this year. I'll start with the green trend line that shows the 7-day average of the number of cases reported daily, and it's measured using the vertical axis on the left. As you can see, we've experienced a small decrease these past few days in case numbers, with an average of nearly 3,000 cases reported per day. But this is a 21% decrease from the 7-day average of nearly 3,800 cases reported per day last week. Despite this decline, current cases are still up by about 120% from 1 month ago. While we're relieved to no longer see steep increases, this is in the context of knowing that cases are severely undercounted. With home tests and people who may not test, transmission is certainly greater than the case count alone indicates, and this is why we use our early alerts to look at other information that helps us better understand transmission. The orange trend line shows the 7-day hospital average hospital admissions. This past week, there was an average of 197 admissions per day. This is also about a 7% decrease from 1 week ago. We're hopeful that this may represent increased uptake of therapeutics and booster shots, which can significantly reduce the chances of developing severe illness for those who are infected. The blue line on this slide shows the 7-day average number of deaths reported daily, and it's measured by the axis on the right. We're currently reporting an average of 16 deaths per day, a troubling increase from the average of 8 deaths reported per day 2 weeks ago. Experience does tell us that deaths are a lagging indicator, and we're concerned about the possibility of seeing even higher increases in these numbers a few weeks from now. I'm also very sorry to share that this week in LA County, we marked a somber milestone as the 20th pediatric death from COVID-19 was confirmed, bringing the total number of deaths from COVID among LA County residents to almost 34,400. I extend my condolences to the child's family and to all families that have been impacted by loss due to COVID. This is incredibly difficult, and my heart is with all of those experiencing grief due to this pandemic. Next slide. To provide additional perspective of our current surge, I want to share this slide that shows the 7-day average hospital admissions on the first graph and the 7-day average number of reported COVID deaths on the second slide for November and December of 2020, 2021, and 2022. The blue line is 2020, before we had widespread vaccination, therapeutics, and at-home testing, and it was just over 6 months since the beginning of the pandemic. Hospital admissions were elevated, and by the end of 2020, we were seeing a very high number of deaths. For contrast, the orange line is 2021, and the red line shows 2022, where we are right now. While hospitalizations are currently lower than they were in 2020, they are still significantly higher from the numbers we were seeing at this time last year. The hospitalization trends for each year are different. In 2020, there was a peak late December before hospitalizations plateaued at a high level. Last year in 2021, the increase was more gradual before we had a sharp rise at the end of December. And it's difficult to predict exactly where 2022 will go. The hope is that measures such as indoor masking, bivalent boosters, and therapeutics will keep hospitalization numbers from increasing much more. For deaths, you can see on the second chart that right around December 10th, this year's deaths began to surpass the deaths seen last year at this time. This is very concerning. Even with the advances in therapeutics and greater availability of vaccinations and boosters, we are still seeing similar numbers of deaths as we did last year. Our data tells us that those dying from COVID-related illnesses are likely more vulnerable due to advanced age, compromised immune systems, or lack of access to health-affirming resources. Surpassing 2021's winter death numbers is a clear sign that the impact of COVID-19 is still being felt across communities today. The best way to mitigate these trends is to use the knowledge we have gained and the tools we can access. Next slide. We do continue to monitor wastewater to better understand the extent of community transmission for COVID-19. And this graph displays our wastewater viral concentrations of SARS-CoV-2. The blue line is a weighted average for viral concentration across the 4 wastewater treatment plants, covering about 75% of the population, and weighted by the population for each plant. And the reporting is for May 29th of 2022 through December 3rd. For the most recent week, the viral concentration in wastewater is higher than it was at the peak concentration seen in July during our summer surge, placing us in the high concern category for this early alert metric. It's important to note that the wastewater data is slightly delayed due to the time it takes for labs to process and analyze wastewater samples. The most recent week shown on this graph is the week ending December 3rd, when we were starting to see those steeply rising case counts. While the data lag may partially explain why we're seeing increasing viral concentrations in wastewater, even though we've started to see recent declines in case counts, it doesn't tell the full story. We know that our case counts are an undercount due to the widespread use of home tests. At the time of the wastewater concentration peak during this past summer surge, our case rate was 461 new cases per 100,000 people. In contrast, even though we've now surpassed that wastewater concentration peak, our reported case rate is only 204 new cases per 100,000 people. This underscores how case counts have gotten more unreliable over time, and it illustrates why we continue to look at wastewater to better understand transmission trends. The high wastewater concentrations remind us that even with slightly declining case counts, COVID transmission in LA County is still very high. Next slide. We're also tracking the weighted average wastewater concentrations for influenza A across the Joint Water Pollution Control Plant, Hyperion, and Lancaster sewer sheds. As you can see, in early October, wastewater concentrations began to rise, corresponding with what we consider the beginning of flu season, and the concentrations have continually increased with a steep upward trajectory. This aligns with the lab-reported data that shows that over 27% of tested specimens for influenza were positive this past week. It is safe to assume that in LA County, we're continuing to see very high levels of flu activity for this time of year. And while we also don't know the exact trajectory of influenza, projections indicate that we should expect to see continued high flu activity this winter season. It's not too late to get your seasonal flu shot, and the same measures you take to protect yourself from COVID-19 will help protect you from flu as well. Although we aren't showing the data today for RSV, we do want to note that we continue to see declines in the proportion of specimens testing positive for RSV. However, because RSV wastewater concentrations remain high, precautions to reduce spread to people who are at high risk, including older adults and very young children, continue to be important. Next slide. We're also very aware of the impact that these high levels of circulating illness are having on the hospital system. On this graph, you can see the number of reported available hospital beds for adults from January through December, beginning in 2019 and going through 2022. The red line shows 2022, and it obviously shows where we are now. The blue line is pre-pandemic, 2019, and the yellow is 2020. The large spike in bed availability during the spring of 2020 was because many hospitals had set up extra beds to cope with the surge at the beginning of the pandemic, and elective procedures were canceled, adding to the available bed count. The data is collected from 90 hospitals that are polled daily by the LA County Emergency Medical Services Agency, part of the Department of Health Services. An available bed refers to beds that are unoccupied and to which a patient could be immediately transferred to, where there would be the necessary space, equipment, and staff available to support the patients. The counts shown on this graph represent monthly averages. As of December 12th, there were 242 available adult beds, including ward and ICU beds across all of LA County. The average number of available beds so far in December is the lowest we have seen in the past 4 years. It's reasonable to speculate that part of the reason for the low number of available hospital beds is due in part to many patients seeking care that may have been delayed during earlier months of the pandemic, and to the high circulating levels of respiratory viruses, resulting in a very high volume of patients. When healthcare staff become sick themselves, it also, as you note, will affect bed availability. We've also heard anecdotally from some hospitals that they're struggling to staff beds due to high retirement rates and nurses leaving full-time positions for different opportunities. Next slide. On this slide, we've graphed the same hospital bed availability data for pediatric beds. This includes the pediatric wards and the pediatric intensive care unit beds. And as of December 12th, there were 88 available pediatric beds across all of these reporting hospitals. As with adult beds, this is some of the lowest availability we've seen in the past 4 years. It's important to note that in LA County, as it is across the country, there are far fewer pediatric beds available in general than adult beds because children generally require hospital care at a much lower rate than adults. However, as we saw this past month, young children can be susceptible to severe illness from respiratory viruses, including RSV and flu. And when levels are as high as they are now, pediatric hospital bed availability can drop rapidly. Everyone's encouraged to take steps to curb transmission of respiratory viruses, and that includes masking in indoor public spaces and staying home when you're sick. Next slide. There's also an impact being felt in emergency departments across LA County. This slide shows data from the current and past 2 flu seasons. The blue line is 2020-21, and 2021-22 is the yellow line, and 2022 going into 2023 is that red line, that incomplete red line. The vertical axis measures the percentage of emergency department encounters classified as being related to what we call influenza-like illness. This influenza-like illness designation captures patients who report to an emergency department with a chief complaint of fever and cough or fever and sore throat. This means that it captures individuals who could have a variety of respiratory illness, including flu or COVID. For the 2022-23 flu season, you can see that the percentage of emergency department encounters, that's the red line, classified as related to influenza-like illness is over 4 times higher than what was seen at the same time during previous years, and about double the peak that was seen over the past 2 seasons. Next slide. The hospital bed and emergency department data are a sobering reminder of why it's so important to take actions now that can help reduce severe illness this season in the event that you or a family member becomes sick with COVID or flu or another respiratory illness. One of the most important things we can each do is to make sure you and your family are up to date on vaccines as soon as possible. This includes having this year's seasonal flu shot and the updated COVID-19 booster. There's growing clinical and research evidence to support that both vaccines are a good match for the strains of virus circulating now for both flu and COVID, and they have the potential to reduce transmission and illness severity. For the 2-week period that ended November 24th, unvaccinated individuals for COVID were 4 times more likely to be hospitalized than fully vaccinated individuals. Antiviral therapeutics for COVID-19 and flu are not replacements for vaccination, but they are an additional layer of protection to prevent severe illness, hospitalization, and death. These medications are available by prescription when you test positive for flu or COVID, and often they can be easily accessed at a pharmacy or through mail delivery. Therapeutics do, however, need to be taken as close to symptom onset as possible. So you'll need to contact your provider if you have fever, coughing and sneezing, unusual fatigue, muscle aches, or other symptoms, and you've tested positive for COVID or flu. If you don't have a provider, you can call the Public Health Call Center at 1 833 540 0473 to get answers to your questions. And for a person infected with COVID, you can access free telehealth services. For COVID-19, as you can see on this table, there are 2 therapeutics that can be prescribed and taken at home, Paxlovid and molnupiravir. You may hear these medications also referred to by generic names. Both should be started within 5 days of symptom onset. Paxlovid can be taken by children as young as 12 years old, and molnupiravir is for people 18 years and older. There may be times when these medications are not appropriate for some people who may be asked by their provider to use remdesivir, an IV-administered medication instead. For flu, Tamiflu and baloxavir are 2 antivirals that are very effective at mitigating symptoms. They need to be started within 2 days of symptom onset, and they can be taken by children as young as 2 weeks old. Many people with flu do have mild illness, just like with COVID, and they don't need medical care or antiviral drugs. However, there are some people that are at high risk of serious complications. This includes people over 65, young people, pregnant people, and people with certain medical conditions. If you have symptoms and you're at high risk, contact your doctor straight away. Antiviral flu treatment should be started as soon as possible, but certainly within 2 days of symptoms. For both COVID and flu, other antivirals are also available that can be administered via IV or in other forms, including for younger children. A provider can advise you on the very best fit. The most important thing to know is that there are steps you can take to minimize developing severe illness, especially if you are in a high-risk group and you're infected. Many people qualify for therapeutics, so please don't hesitate to reach out to your provider to discuss your options once you've tested positive. And just in case therapeutics aren't going to be a good fit, it's always important to stay home, rest, drink lots of fluids, and take precautions to avoid spreading illness to others. If you've tested positive for COVID, please stay home and away from others, at minimum through day 5. If you have a negative test, day 5 or later, you can leave isolation before day 10. Otherwise, you'll need to remain isolated from others through day 10, and then exit isolation, provided your symptoms are resolving and you are fever-free. Next slide. As noted last week, specially formulated bivalent boosters for children 6 months through age 4 were given emergency use authorization. Previously, the bivalent booster was authorized only for children 5 years and older. The safety and effectiveness of this new bivalent booster was evaluated through multiple clinical studies, showing that the vaccine produces a positive immune response against COVID-19. Commonly reported side effects include irritability and sleepiness, loss of appetite, and tenderness at the injection site. In order to maximize protection against COVID-19, dosing and eligibility for this new booster is dependent on the primary series that the child receives. If a young child's primary series is Moderna, 2 months after completing the primary series, that's 2 doses, the child is eligible to receive the updated Moderna bivalent booster. For children 6 months to 4 years old who have started or need to start their Pfizer 3-dose primary series, yet have not finished it, the 3rd dose in the series will be the Pfizer updated bivalent booster. So they will be substituting with the new bivalent booster formulated for young children instead of the original primary series vaccine. If the child in the 6 months to 4 years old age groups already completed their 3-dose primary series with Pfizer. No additional doses are needed at this time. If you have questions about vaccinating your child, you can call the Department of Public Health Vaccine Call Center at 1-833-540-0473, open daily 8 a.m. to 8:30 p.m. Many vaccine sites in LA County received the new bivalent vaccines for young children this week. At the DPH community sites, clinics, and mobile vaccine teams, staff have already been trained and began administering these new vaccines yesterday. To find a vaccine site, you can visit ph.lacounty.gov/how-to-get-vaccinated, or you can reach out to your provider. I do want to note that many pharmacies don't vaccinate children under 3, so please check our website or contact your provider to find a site that's able to vaccinate a young child. Next slide. We're grateful that the free bivalent boosters are now widely available across age groups. On this slide, the height of each bar shows the number of LA County residents who are eligible for the bivalent booster by age group, meaning that these are the people who completed their primary vaccine series at least 2 months ago. The orange shaded portion of the bar is the number of eligible residents in that age group that have received the bivalent booster, and the gray portion of the bar is the number of eligible residents who have still yet to receive the bivalent booster. In total, nearly 7.5 million residents are eligible for the bivalent booster. And of those eligible, 1.35 million residents have received the new booster. And while the number of residents with additional protection remains low, we have seen an increase recently. In the past 2 weeks, we went from 16% on November 27th to 18% this week. We've seen the highest uptake among residents 65 and older, where 1/3 of eligible residents receive the updated bivalent booster. But that leaves over 800,000 eligible people in this much higher risk group who have not yet taken advantage of the new booster. Uptake is lowest in the 12 to 17 years age group at just over 8%. More than 550,000 children in this group are eligible for, but still have not received the bivalent booster. And this is especially important considering that there are exposures in schools, during extracurricular activities, and potential interactions with older, higher risk adults, including grandparents. The age group with the greatest number of eligible people who are not boosted yet are people between the ages of 30 and 49, many of whom participate actively in the workforce. Nearly 2 million people in this group are eligible but have not received the updated booster. For those who are not protected with the bivalent boosters, please know that the booster is widely available, and you can just drop in many times to your local pharmacy or a community vaccination site without an appointment. We also have over 700 pop-up clinics across the county every week at community events, community work sites, and parks where you can also go to get vaccinated. If you're not boosted because you already had COVID-19, please know that if it's been more than 3 months since your infection, immunity is waning and a bivalent booster can help. Tackling COVID is about layering protections, and the bivalent booster is a powerful first line of defense. Next slide. Based on the CDC's community levels framework, this week LA County remains in the high community level. Today's case rate is 204 new cases per 100,000 people. This is a very small decline from last week, but it's still above the threshold of 200 and indicates very high transmission. The CDC designates a county at being in high community level when their case rate is above 200 new cases per 100,000 people, and either one of the two hospital metrics are above 10. For the first hospitalization metric, the number of new COVID-19 admissions per 100,000 people, LA County is currently slightly above 14. Since this is above 10, that qualifies us for remaining in the high community transmission level based on CDC's criteria. For the second hospital metric, the percentage of staffed inpatient beds occupied by COVID-19 patients, LA County is currently at 7.2%, which is below the high threshold of 10%. COVID-19 community levels help convey how much impact COVID is having on the community and the hospital system based on recent data. Counties that are designated at the high community level are urged to take both individual and community actions to reduce risk. Next slide. To better understand the potential changes in COVID-19 transmission, public health does continue to monitor 8 early alert signals. These metrics provide additional information about the effects of COVID-19 in the community. The impact of more transmission is felt across the healthcare system and among vulnerable communities. 3 metrics are of medium concern this week: the percent of emergency visits for COVID at slightly over 7%, the 7-day cumulative age-adjusted case rate for the lowest income areas, and the number of worksite cluster reports in the past 7 days. 4 metrics are of high concern: the percentage of specimens identified as a new subvariant or sublineage of interest, the SARS-CoV-2 wastewater concentration that I reviewed earlier, the number of new outbreaks in skilled nursing facilities over the past 7 days, and the number of new outbreaks in TK through grade 12 classrooms in the past 7 days. While many schools will soon be on winter break, I do want to share some actions that are being taken to reduce disruptions and outbreaks at schools. Students and staff are being urged to stay home when sick, and students and staff are also being asked by public health to mask when they're indoors and to implement periodic testing for high-risk activities, including indoor medium and high-contact sports, singing, band, and orchestra. And finally, testing is strongly recommended before large school events and before the return to school after breaks. All schools have been offered free test kits to distribute to students and staff to encourage testing before return to school after the winter break. While the number of outbreaks in skilled nursing facilities is still high, I want to note that we're starting to see some decreases this week. Last week, there were 54 outbreaks opened in the past 7 days. This week, there were 36. Skilled nursing facilities recently implemented across the board testing for visitors and requiring that all staff wear N95 respirator masks. I want to thank the staff and visitors for their tremendous efforts to help curb these outbreaks. The only signal that remains of low concern is the number of new outbreaks among settings serving people experiencing homelessness. This likely reflects the prevention efforts undertaken by a vast network of shelter operators, housing providers, and street teams, and we're grateful for their continued efforts. The next slide. Because the new strains of COVID-19 that gain dominance have been linked to increased potential for infection, we carefully monitor circulating variants and sublineages in LA County. BQ.1 is the newly dominant strain in LA County, and you can see that by the pink bar, and accounts for 31% of specimen sequence. Combined with BQ.1.1, represented by the purple bar, these 2 strains account for 55% of specimens, as noted in our early alert metrics. BQ.1 and BQ.1.1 continue to crowd out BA.5, the previously dominant strain, denoted by the red bar, that now accounts for less than 25% of our specimens. We also are watching other emerging strains. As of November 12th, XBB, remember this is a recombinant strain of 2 BA.2 sublineages, denoted by the small yellow bar at the top of the graph, is now accounting for just about 6% of specimens. XBB has a mutation that has been linked to increased immune evasion, warranting caution. The local data shown on this slide always has a 2 to 3 week lag due to the time it takes to sequence specimens. CDC's national data has this same lag, but they can calculate predictions of the estimated proportion of each of the sublineages circulating now. These estimates show that BQ.1 and BQ.1.1 will likely continue to be the dominant strains, accounting for nearly 70% of sequenced specimens, while BA.5 will drop down to account for just over 10%. While researchers continue to learn more about the new strains circulating, the dominance of BQ.1 and BQ.1.1 are likely making it easier for transmission of the virus, even among those with prior infections. Next slide. With schools going on break soon, Uh, World Cup soccer games this weekend and many winter holidays ahead. We recognize that for so many, this is a magical time of the year with many opportunities to enjoy the company of extended family, colleagues, and friends. And we encourage everyone to take time to connect with those you care about. Given high rates of circulating respiratory illnesses, we can all take a moment to plan ahead for our activities and events. In addition to keeping everyone healthy, hopefully disruptions to travel and cancellation of plans can be minimized with some advanced preparation. Best to be sure you have masks on hand, preferably N95s, KN95s, or KF94s. Look at your supply now, throw away masks that have stretched out ear loops, broken nose pieces, and if you need to, this would be the time to replenish your stock. Make sure your masks are easy to access when you enter indoor public spaces in transit. You might even consider putting a new mask in the coat pockets, bags you carry regularly, and in the car so you're always prepared. If you haven't received your bivalent booster or seasonal flu vaccine, it still makes a lot of sense to get vaccinated as soon as possible. You can get both the bivalent COVID booster and the flu vaccine at the same time, and many vaccination sites offer both. So check your neighborhood for locations where you can drop in or make an appointment. When you're choosing activities or planning events, it still makes sense to look for outdoor options. If it doesn't work to be outside, open windows and doors to increase ventilation inside. Have COVID tests on hand to use before gatherings. You can stock up now so that you have them when you need them, especially if there's a last-minute invite or an event. Insurance plans are required to reimburse for the cost of tests. More information on the types of tests, where to get tests, and how to interpret tests is available at ph.lacounty.gov/COVID tests. Keep each other informed and talk to friends and family about when to stay home and what symptoms to be aware of. Normalize these conversations and leave space for people to decline invitations or cancel plans if they don't feel well. Celebrations are about gathering in ways that work well for everyone. Next slide. We're also happy to share some great news from the White House. Given the higher rates of transmission across the country, as of today, the federal government has reopened its program to provide free COVID tests. With this relaunch, each household is eligible for 4 free tests that will be shipped to their home at no cost. The tests can be requested from covidtests.gov, and shipping will begin the week of December 19th. I want to note that I went on the site and it took 1 minute, literally, to order the tests. Like, you just have to fill in like 4 different lines and then you're done. So it's easy. And we know that there are some people that don't have access to computers, so we urge them to make use of all of the other places where we distribute free test kits as well. But for those people with access, it's pretty easy to go and sign up. And it does make sense with lots of COVID transmission for everyone to take advantage of this program while it's open. Knowing your status before you gather and or travel can make a big difference in dampening transmission and protecting those most vulnerable for severe illness should they get infected. In closing, navigating the pandemic has been made much easier with the new tools at hand and the data we can look at to better understand risk. High numbers no longer mean shutting down events or gathering over Zoom. We have the strategies, information, and resources to celebrate in person with friends and family in safe ways. I hope that over the next few days, everyone can use this information to keep each other protected. Simple efforts can lead to big returns, and this works best when people come together and act collectively. We all continue to have a role to play to reduce COVID-19 transmission, and I appreciate the inspiring efforts I've witnessed in the community. Your actions have personal impact and also impact the people around you, even those you don't know. I wish everyone a joyous start to the holidays, and I'll now take your questions.
Hi, Dr. Fur. I have a few questions for you. I just wanted to clarify that the available hospital beds are at an all-time low during the pandemic.
Yes,
That is correct?
that is correct.
Okay.
Now, it's important to note that,
Microphone?
oh yeah, sorry. It's important to note that in 2020, two conditions were very different. One, everyone added surge capacity, and everyone stopped doing any sort of non-essential procedures. Since that time, since the end, really, since we got through the 2020 first part of the pandemic, hospitals have returned for the most part to more normalized operations. And while some hospitals have added, occasionally, especially during surge, additional beds, in general, the comparison is a little hard to make to 2020. It's much easier to compare 2021 with 2022.
Okay, and the majority of the people in the hospital then are still there with COVID?
So the majority of the people in the hospital are there with incidental COVID still. I mean, those numbers fluctuate. When we're in the height of the surge, the number of people that are hospitalized because they're sick with COVID-related illness goes up, way up. It goes up as high as 60%. But when we're not in the surge, that number can drop to 40%. Currently, I think we're at like 44%. So we started going up, which of course is concerning. But it's a great point, Maria. Thanks.
I actually am going to piggyback off that. Last week, you were optimistic that we were on a downturn, and I'm wondering how you're feeling this week.
Yeah, I'm still optimistic. I'm hopeful. You saw, I mean, on our metrics that indicate particularly stress at the healthcare system, we have not seen an increase in those admission rate. We were kind of stable at about 14. And we saw just a very small increase in the percent of folks that, in fact, are COVID positive in the hospital. So I do remain optimistic. I mean, we know that there is a relationship between transmission, though, and hospitalizations. I think the troubling number for all of us is that the case rates underrepresent the real count of transmission, which is why we continue to see relatively high numbers of people in the hospitals, even though our case rates are slightly lower than they were at other times during surge. I think that's because the case rates don't really reflect the true amount of transmission. I'm also troubled, and you saw this, with the death data. People can be concerned and note that the hospitalization numbers can be a little bit misleading because they really account for a lot of people who are in the hospital for other reasons. But the death data really does reflect people who are dying of COVID-related illness. It's distressing to see that number be slightly higher at this point in the winter season than it was last year. And it just, again, indicates for some people this remains a very deadly disease, and we need to continue to make sure they have access to preventive measures that would hopefully avoid the need for them to experience severe illness and then tragically end up passing away.
Okay, one last question. It's about XBB. So we're seeing this creep up, and that is a mutation from a B.2 strain,
Yes.
which our bivalent booster. Does it work on that?
Well, the bivalent booster, remember, has the ancestral strain, so it's got some protections from what was been circulating since the beginning, but it also includes protections specific for BA.4 and BA.5. And obviously, if we were to start to see a huge increase in a variant or a strain that's BA.2 or a BA.4, a BA.275, it would be cause for more concern. Every time we see a new strain that dominates, even with BQ.1 and BQ.1.1, everybody gets concerned because there's no telling exactly how much evasion of prior protections we're going to see. We do know that the only way to crowd out what already was circulating is to be more infectious.
You know what? I was going to ask a couple from Ron
Yep,
Lynn at the LA
sure.
Times. Do you think we will still exceed the threshold to trigger a mask mandate, and if so, when?
It's a great question. No crystal ball. It depends, honestly, on what happens uh, after we get through, these next couple of weeks with the winter holidays. I mean, I think we went up pretty quickly after Thanksgiving, and that reflected all of the additional gatherings and travel over Thanksgiving, and now we've kind of plateaued a little bit. I think we may increase again after December 25th as more people are out of school, out of work, taking vacations, traveling, and gathering. And I don't have any way of knowing exactly how high that will go. A lot of it depends on how many protections people are taking and how careful we all are.
His next question is regarding the updated booster for babies and toddlers. Are most of those who are already vaccinated eligible for the updated booster, or are some out of luck because they've already gotten 3 Pfizer shots?
Well, the only ones, I mean, I don't want to characterize it as out of luck because there was a rigorous review that determined if you had those 3 Pfizer doses, remember that's 1 more dose than the babies who were vaccinated with Moderna got. If you got those 3, you have pretty decent protection. That's equivalent to having to getting another dose. So they're really recommending it for those who got Moderna, and this would be a 3rd dose for those babies that got only 2 doses so far. But you're right, Ron, like there is no recommendation right now from the FDA that if you had those 3 doses and you're 4 or under with the Pfizer vaccine, you're not eligible right now for the bivalent booster.
Okay, and one more question. Given that at-home testing has caused official case counts to be such an undercount, what do you think the true number of infections might be?
But that is a question we get asked a lot. We really can't tell locally. I think nationally there have been estimates that, maybe 5-fold higher. But again, I think it's very, very hard to tell. I do want to be clear. We are very grateful that people can test at home, and I'm more encouraged that we have that capacity than I am worried about the fact that our case counts underrepresent the true level of transmission. First of all, the wastewater data is pretty good. Second of all, what we really have are good measures around hospitalization, where we get a lot of information, and around deaths. So I think between wastewater, what we see in the emergency departments, what we see at the hospitals, and what we understand about the people who die, we have a pretty good picture here in LA County of what's going on. And the reality is the trend lines are really important. You start seeing steep increases in an undercount on cases, you're in trouble. So even if it's an undercount, if the line starts going up steeply, you've got a problem. So I feel pretty confident that the information we're using is giving us a decent picture.
This week, I interviewed the new board chair of the Board of Supervisors, Janice Hahn. She told me that she does not support a mask mandate, said that she doesn't think that the public would even comply. There's no appetite for a mask mandate. Have you talked to her? If so, what can you share? And also, perhaps more importantly, without support of the board, no mandate, right?
Well, that's actually that's actually more complicated than it's being presented. Supervisor Hahn hasn't really talked directly to me. Her staff have indicated that, she's hopeful that we'll avoid reaching the thresholds that would indicate that we would return to universal indoor masking. There are 4 other board members as well, and I think as all of us have experienced, different board supervisors have different perspectives on what we need to do to keep each other safe. I think there is, however, a concurrence and agreement that right now, the most important thing we all can do is put those masks back on when we're indoors, protect each other, get boosted, get vaccinated for flu, make sure you're using our ability to test to avoid asymptomatic spread. And by all means, if you need therapeutics, get therapeutics. So I feel like the message right now is consistent across all of the board, and we'll move forward in that direction.
She was pretty adamant about the public will not being there. What's your response to that?
I think we all have experienced the fact that there's a lot of differences of opinion on what are the next steps that we need to take. I hear from lots of different people with lots of different ideas. I also hear from a fair number of people who, wish we were putting back in place a universal indoor masking now. Those are generally people who are more vulnerable, people who have children who have who are medically fragile, people who themselves are medically fragile. But in LA County, that's millions of people. So I think that what is hard and what we've acknowledged is very hard for all of us is, we're going into year 3 and we'd like to be done. And symbolically, keeping a mask on for us in this country where we don't have a history of wearing masks to protect ourselves from respiratory illnesses has been really aligned with that, this pandemic might never end. And I think the supervisor is right in noting that there are some people in the public who really are just done with this pandemic. Our job in public health is to really continue to do our very best to prevent people from having severe illness and dying, and to use all of the tools available to make sure that our healthcare system works for everyone who needs healthcare, not just people with COVID, but everyone, so that it doesn't get so stressed that care gets compromised.
I have 2 more questions, one about wastewater and then the other one about close contact. Wastewater, you spent a lot of time on that today. That's where you say that the truth lies.
Some version of the truth.
Do you foresee using wastewater to form policy?
Well, we use wastewater to better understand transmission. I mean, I've said right now what we're doing is triangulating data, using multiple points of information to try to better understand what's happening with transmission. And periodically I also am very clear that it's also not uniform what's happening. Some communities continue to get hit harder than other communities, and we pay attention to that as well. I will say where we are right now is the biggest worries are people getting so sick that they need hospital care and people passing away. And so a lot of what we're trying to do is understand the relationship, not just between transmission and our numbers on cases, but how well are we doing on getting folks boosted? How well are we doing on getting folks Paxlovid so that we can really avoid people who do end up getting infected needing hospital care?
My question about the close contact, the 10-day close contact. I heard from some parents.
Yeah.
I know they're going on break, but still this seems to be happening, where their child, say on a Monday, is identified as a close contact mask exposure.
Yeah.
So then they go to school, they have their masks on.
Yeah.
Then Friday, they get another notification that they are
Another
close contact exposure. Had their mask on, so isn't the mask supposed to prevent an exposure?
Well, it doesn't prevent an exposure. We all know that. I mean, personally, we all know that we know people who wear their masks and still get exposed. It does reduce your chances. And we are aware that every time we go into like surge or we have lots and lots of outbreaks, you feel like there is a revolving door of I'm constantly being re-exposed. And because I'm constantly being re-exposed, I'm always having to keep my mask on. I will say that these periods of high transmission are often of limited duration. What we've done here at the Department of Public Health is we require all our employees now to wear their masks when they're indoors. That's because we have too many people who are getting infected and it's too easy for it to spread. And just like you said, following those rules about I got an exposure, I put my mask on, but before I'm even out of that first exposure, I got exposed again. Now I'm going to keep my mask on again. I mean, these are precautionary steps we're taking, but when you have that many exposures, the best thing to do is probably keep your mask on when you're indoors.
So then the 10 days needs to start from that second exposure.
That is the way it works.
That is the way it works.
That is
Okay.
the way it works.
Okay.
But I do appreciate that question, and I do appreciate the concern that, you could be in this endless cycle of having lots and lots of exposures. But the reality is that happens most frequently when we have lots and lots of transmission, and much less frequently when transmission rates are way down.
But when you say that the mask doesn't prevent exposure,
It doesn't, nothing's 100%. Nothing. I mean, honestly, if we all thought that we kept our masks on and it would 100% protect us from all respiratory viruses, I think many more people would go ahead and say, I'm going to wear that mask. But because we know that what the mask does, it adds a very important layer, but nothing's 100%, then people start doubting why it would be important. Everybody wishes, the vaccines were 100% effective. Remember at the very beginning when if you got vaccinated, you actually had very small chances of getting infected, and we were all like thrilled with that. And then, we found out over time that actually didn't stick. So I think we just have to be realistic. One thing I do want to note is just because you raised this question, Maria, is that parents who have parents who have children who have health and safety concerns around mask wearing have been allowed by the Department of Public Health, and this is up to the school districts, to seek an exemption from mask wearing. We really understand this as you would get a note from the child's healthcare provider, that can be a social worker, a doctor, a nurse, that says that there are health and safety concerns for that child with mask wearing, and then that child is actually exempt. So I do want to appreciate that there are parents who legitimately are working with a provider and have determined that it is not either safe or health affirming for that child to wear that mask. And we've listened to a lot of parents say that and have made that accommodation.
Thank you. No other questions.
Okay, great. Thank you, everyone.
Thank you.
We'll see you next week.
Is it,
Next week we'll be back at 2.
I don't know if we're still on. Are you confident for this particular surge that we have already peaked as far as the cases?
No, we've peaked for now. I think what we're going to see is a little bit of a plateau.
Okay.
And then I would say as we get closer to Christmas and Kwanzaa, and there's Hanukkah, winter solstice, we have big World Cup games this weekend. I think that might drive another increase in our cases. But I don't have a crystal ball. So I think we just plateaued. We're not really going down significantly.
Okay.
What we are not doing right now is going up significantly on the cases. But I think there's still a lot of transmission. And that's what the wastewater data says.
Thank you.
Okay.